Was brought to you by Buick. Diane?
All right, thanks a lot, Sam. Well, this morning it is the GMA On Call, and Internet pioneer Steve Case is here with us. He says it's time to revolutionize healthcare in America, all of us doing it together. He has a new website, Revolution Health, and Steve Case joins us right now along with ABC's medical editor, Dr. Tim Johnson. Hey, good to have you both here, Steve. I want to start because I know that this is an online adventure, but it also is guided by something very personal, an experience you had in 2001 when your brother was diagnosed with a brain tumor.
Right.
And finding your way through the healthcare system, even you, was a horrifying exercise.
It was scary and complicated, and we certainly had good care and were able to talk to a lot of people. Even then, it was hard to get information about what to do. What some of the treatment options were, and it just dawned on me that if we have that issue, imagine what millions of people in this country struggle with every day. And so when I left AOL and was wondering what I should do next, I said, well, spent 20 years trying to make the internet accessible to a mainstream audience. Maybe I should spend the next 20 years trying to make healthcare more of a accessible and probably put the consumer back at the center of the healthcare system. And that's what Revolution Health and our site revolutionhealth.com is all about.
It will take the consumer to change it, and I want to talk about some of the practical things that we can all understand, because you do say to yourself, yeah, I'd like to have that. First of all, a doctor rating by the consumers, by the patients, who will be able to go online and tell you which doctors they like and didn't like.
Right.
With numbers, you're going to have a listing of them, community by community.
Yeah, that's what we call it, revolution. We think it's crazy that people have tools to rate movies or restaurants, but not tools to rate doctors or hospitals or treatment options. And it'll take a while to build this up, but we think the notion of the wisdom of the crowds and getting everybody to contribute to what we call revolution ratings is very important. That's one of the key things as part of this revolutionhealth.com site. How do you get consumers to actually participate, not just read information on a site when they're sick, but go there frequently to stay healthy and help others to stay healthy and understand what their options are.
We wanted to have Tim here too, because Tim, as a physician, what does that mean to you that suddenly your patients are going to be going online and telling about their experience?
Well, I think there's probably a reason why we rate movies and restaurants before healthcare. It's a little simpler because healthcare is a little more complicated. I think consumers can certainly talk to each other about their doctor's personalities, how they run their office, are they polite, are they tardy, et cetera, et cetera. It's a little hard for an average layperson to assess the skill. I mean, how do you know who really is the best colonoscopist? That's why around ABCs, people come to me all the time trying to find a good doctor. And even I have trouble doing it. So I'd say, for me, the ultimate answer is to be a part of a good system that takes care of that for you. Like I belong to Partners Healthcare, Kaiser Permanente. They find good doctors, they rate them, they make sure they have good quality. I think in the long run, a system can do that work for you, but consumers can certainly talk about some things that are helpful. And
added value, you were saying that people talk to each other anyway. You get a lot of doctor references just from talking to your next door neighbor.
This is the way it happens. And insurance companies and the doctors and hospitals and their networks, I think they do a good job. But I think often consumers feel like that maybe they don't necessarily provide all the options and maybe don't provide a totally unbiased perspective on that. And that's what we're trying to do, just add that to the equation and give people a full array of choices.
Other things you have on the site, you have physician advice and symptom check. You can run your symptoms through kind of cross-reference?
Yeah, so this is what we're doing in partnership with Mayo Clinic. We recognize that all of the consumer aspects, sort of the wisdom of the crowd, social networking, if you will, is very important. Having the wisdom of the experts is also important. So we're working with Mayo Clinic and Cleveland Clinic and Harvard and many others. And revolutionhealth.com is designed to take the best information from the best sources and put it in one place that's easy to use and then supplement it with the consumer side.
Something I know you both agree on here is medical records. Is you should have a way to transfer your medical records wherever you are should you need them at a moment's notice. Is there a privacy problem with that? If you go on Revolution, you post you have your medical records there available to you, but is that a privacy concern?
Well, Steve can speak to that, I'm sure, but that has been one of the concerns as they've been trying to develop, and it's a shame that we do not yet have some kind of standard electronic record that people can have and take with them wherever they go. We're getting close to it, I think, and the government will play a role in this simply because they provide so much of the insurance in this company, but it really is a tragedy we haven't arrived at that point.
How do you
it's one of the things we're trying to make free to everybody. Everybody's debating what the standard should be on electronic records. Part of revolutionhealth.com is giving everybody access to free records, which stay with them. Because one of the problems with the current records is if you enter the information for a particular employer but switch jobs, you have to re-enter the information. If your employer which is health plans. Often you have to re-enter information. We want revolutionhealth.com to stay with you for decades and to help you and your family navigate through this complex world of healthcare. So what we're doing is for the consumer. The consumer owns those records, and they decide when and how it's used, not somebody else.
You feel the way you did about this as you did about AOL? Because a lot of people, of course, are always saying, there's always somebody saying, this is crazy, right? This
Sure.
is immense.
Well, that's part of the reason I'm doing it. Everybody said, healthcare is so complicated that it's impossible to change. I said, well, that's not a good answer. I do remember 20 years ago when we were getting started, people said, nobody ever will want interactive services. It's kind of a computer hobbyist thing, but we believed that someday it would be a mainstream phenomenon. Similarly, I believe that, healthcare has to change. It has to be revolutionized. And our bet is by putting the consumer in the center and giving them the tools to take control of their healthcare and their family's healthcare over time, we can revolutionize healthcare. And that's what we're trying to do with the site we just launched, revolutionhealth.com, and some other products and services we're launching as well.
Well, I know that it's available right now. It's a formal announcement coming up in April. But I suppose in the internet world, if somebody doesn't say you're crazy, you're not trying anything interesting.
Exactly.
All right. It's out there, revolutionhealth.com. Thanks, Steve.
Thank you.
Tim. We'll be